Welcome to our video on 8 warning signs of clogged arteries. When you think about clogged arteries, what comes to mind? Most people think of heart attacks, strokes, or even heart disease. But did you know that clogged arteries don't always cause symptoms right away? In this video, we'll talk about 8 warning signs that your arteries might be clogged. We'll also discuss how to recognize these signs early on, so you can take action before things get worse. Early detection is crucial in managing and preventing complications from clogged arteries. The earlier you catch the signs, the more effective your treatment will be. Let's dive in. Health-conscious men, listen in. Kicking off our list at number 8 is erectile dysfunction, ED, an essential topic in male health. Though this is commonly associated with aging or other health conditions, ED can also be a sign of poor circulation caused by blocked arteries. ED occurs when there is reduced blood flow to the penis, which can be a result of blocked arteries. Atherosclerosis narrows and hardens the arteries, restricting blood flow to various parts of the body, including the reproductive system. A study from the American Journal of Hypertension found that men with erectile dysfunction have a significantly higher risk of cardiovascular diseases. This is because the same plaques that block arteries in the heart can affect the blood vessels in the penis. ED is often an early warning sign of atherosclerosis, and treating it early may help prevent more severe cardiovascular events. So, if you're experiencing ED, along with other symptoms of blocked arteries, it's crucial to address this issue as early as possible. At number 7 is chest pain or angina. Angina happens when your heart muscle doesn't get enough oxygen-rich blood. When an artery becomes narrowed or blocked by plaque, the blood flow is reduced. This means less oxygen gets to the heart. This can cause pain or discomfort in your chest. You may feel tightness, pressure, or a squeezing sensation. Some people describe it as a heavy weight pressing on their chest. A study from the journal BMC Cardiovascular Disorders found that chest pain is one of the first symptoms of coronary artery disease. This occurs when the arteries supplying blood to the heart become blocked. So if you notice chest pain, don't ignore it. This could be a sign of serious heart problems that need immediate attention. Left untreated, it can lead to a heart attack. There are different types of angina, including stable and unstable angina. Stable angina usually occurs during physical activity or emotional stress, and it goes away after resting. Unstable angina is more dangerous and can occur unexpectedly. It's important to get any chest pain checked out by your doctor immediately to rule out more serious conditions like a heart attack. Sliding into number 6 is shortness of breath. When your arteries are clogged, the heart has to work harder to pump blood throughout your body. This can lead to feelings of breathlessness, even during simple activities like walking or climbing stairs. Shortness of breath may be especially noticeable after physical activity, or even when at rest in some cases. This happens because when blood flow to the heart is limited, the body struggles to get enough oxygen. As a result, your lungs and heart have to work harder to compensate for the lack of oxygen-rich blood. If you find yourself feeling unusually winded or out of breath, it could be a warning sign of clogged arteries. It's important to take this seriously, as it can lead to more severe complications like heart failure if left untreated. Shortness of breath can lead to oxygen deficiency throughout the body, causing fatigue, dizziness, and a reduced ability to perform daily tasks. It is often more noticeable during physical exertion or when performing activities that you normally wouldn't have trouble with. If you suddenly find yourself out of breath after walking up a flight of stairs, that might indicate that your arteries are clogged. This is because your heart isn't able to supply enough blood and oxygen to your muscles and tissues during physical activity. Coming in at number 5 is fatigue. Feeling unusually tired or fatigued can also be a sign that something isn't right with your arteries. When your arteries become blocked, your heart has to work harder to pump blood. This can make you feel tired or low on energy. It's important to note that fatigue due to clogged arteries is not just regular tiredness. It's a persistent, unusual tiredness that doesn't go away with rest. A study published in the journal Frontiers in Psychiatry found that fatigue is a common symptom in people with coronary artery disease. This fatigue often occurs because the heart isn't getting enough oxygen, which affects the entire body's ability to function properly. You may find yourself feeling exhausted after tasks that would normally feel easy, such as doing the laundry or walking to your car. Fatigue may be more pronounced after performing routine activities. If you find that simple activities like taking a walk or doing the dishes leave you feeling completely drained, it might be time to check with your doctor. Another important thing to consider is how long this fatigue lasts. If your tiredness feels like it's out of the ordinary or gets worse over time, it's crucial to seek medical advice. At number 4 is dizziness or lightheadedness. When your arteries are blocked, it can reduce blood flow to the brain, leading to feelings of dizziness or fainting. This is especially true when standing up too quickly, which may cause a sudden drop in blood pressure. Dizziness can also happen during physical activity or after exercise if your heart is unable to pump enough oxygen-rich blood to your brain. Research from the journal Critical Care suggests that poor circulation to the brain can cause dizziness, which could be a result of clogged arteries. If the arteries that supply blood to your brain become narrowed or blocked, it can lead to lightheadedness or even fainting spells. You may also want to monitor any other symptoms, such as headaches or blurred vision, which could indicate that the problem is more severe. Some studies also suggest that the narrowing of the carotid arteries, which supply blood to the brain, may contribute to dizziness. However, when it happens alongside other symptoms like chest pain or shortness of breath, it could point to clogged arteries and require immediate attention. Number 3 on our list is swelling in the legs, ankles, or feet. Another warning sign of clogged arteries is swelling in the legs, ankles, or feet. When blood flow is restricted, it can cause fluid to build up in your lower extremities. This is often referred to as edema. The body's inability to circulate blood properly leads to fluid retention, particularly in the legs. Experts found that people with poor circulation due to blocked arteries are more likely to experience swelling in the legs. The reduced blood flow causes fluid to collect in the tissues, leading to puffiness or swelling. At number 2, numbness or coldness in the limbs. Another warning sign is numbness or coldness in your arms or legs. When the arteries that supply blood to the limbs become clogged, the blood flow is reduced. A study published in the American Heart Journal Plus explains that reduced blood flow to the extremities is a common sign of peripheral artery disease, PAD. This study highlighted that it is caused by plaque buildup in the arteries outside the heart. Numbness or coldness in the limbs can also be a sign of a more advanced stage of PAD. If left untreated, PAD can lead to severe complications, including gangrene, and may require amputation in extreme cases. Therefore, if you experience these symptoms, it's important to see a doctor as soon as possible for an evaluation. Other signs of PAD may include a decreased pulse in the legs, hair loss on the legs, and skin changes like pale or shiny skin. These symptoms can also indicate clogged arteries and require professional medical attention. Finally, at number 1 is high blood pressure. When your arteries become narrowed by plaque buildup, the heart has to work harder to pump blood through the body. This can cause your blood pressure to rise. Studies show that high blood pressure is a key risk factor for heart disease and can be a warning sign of clogged arteries. If your blood pressure is consistently high, it's important to get it checked and discuss treatment options with your doctor. High blood pressure is often called the silent killer because it doesn't show noticeable symptoms. However, it can increase your risk of heart disease, stroke, and kidney damage. Monitoring your blood pressure regularly is one of the most important ways to prevent clogged arteries from leading to these dangerous health problems. Now that we've gone through the warning signs, let's talk about how to protect your arteries. There are several things you can do to help prevent clogged arteries and keep your heart healthy. Number 1. Eat a healthy diet. Focus on eating foods that are low in saturated fats, trans fats, and cholesterol. Include plenty of fruits, vegetables, whole grains, and lean proteins in your diet. Number 2. Exercise regularly. Exercise is essential for heart health. Aim for at least 30 minutes of moderate exercise most days of the week. Number 3. Don't smoke. Smoking damages your blood vessels and increases your risk of heart disease. If you smoke, quit as soon as possible to help protect your arteries. Number 4. Manage stress. Chronic stress can contribute to high blood pressure and other heart-related issues. Number 5. Get regular checkups. Regular visits to your doctor can help catch any issues early. Your doctor can check your blood pressure, cholesterol levels, and overall heart health to make sure your arteries are in good shape. Number 6. Consider medications. For some individuals, medications may be necessary to manage the symptoms of clogged arteries. Clogged arteries are a serious health concern, but the good news is that by recognizing the warning signs early, you can take action to protect your heart. If you experience any of the symptoms in this video, make sure to speak with your healthcare provider as soon as possible. Remember, your heart and arteries are crucial for overall health, so it's important to pay attention to your body's signals and take steps to protect them. We'd love to hear from you. Which of these warning signs surprised you the most? Have you noticed any in yourself or a loved one? Let us know in the comments below. If this video helped you, please like it, share it with someone who might need it, and subscribe to the channel for more vital health tips. And don't forget to tap the notification bell so you never miss out. Thanks for watching and take charge of your health today.